Well, good afternoon, everyone. Thank you for being here. I'm joined today by Lieutenant Governor Jeff Duncan, Speaker David Ralston, Atlanta Mayor Keisha Lance Bottoms, of course, Dr. Toomey with the Department of Public Health, General Carden with the Georgia National Guard, General King with the Department of Insurance, and Fulton County Commission Chair Rob Pitts. As you all know, over the past few weeks, we've been working around the clock to address the impact of coronavirus in Georgia, making plans for the future, and giving timely updates to the public. I can assure you that we will continue to do that. We appreciate everyone who is heeding the guidance of federal, state, and local officials. Before I get into specific updates, I want to start off with this. All of you have seen that we're starting to have large event cancellations and school closures across the country. As a result, we're hearing from people in every region of Georgia asking us for advice. In many ways, our message continues to stay the same. We would like to ask people to continue to follow best practices of your health with regular hand washing, avoiding large events if you're sick, and once again, let me remind everyone that this information continues to be available through the CDC and the Department of Health. But here's where our message is changing. Elderly Georgians and those with chronic underlying health conditions face a much higher risk of adverse consequences from exposure to coronavirus. We must take extra care around elderly individuals, people with ongoing health issues, and those who have a suppressed immune system. We need to help them dramatically limit their exposure to the public for the foreseeable future. Health officials are now telling us that these vulnerable populations need to avoid mass gatherings and locations with high traffic counts of people, even faith-based services or events. I've already had this conversation with my mother to keep her safe and plan how we can get her what she needs in the weeks ahead. We cannot be too cautious in this area, and I would urge you all to do the same. Starting as soon as possible, I'm calling on all families across Georgia to get together and talk about how they're going to protect their grandparents, how they're going to protect their loved ones with health conditions, and how they'll come up with a game plan for getting them what they need: groceries, prescriptions, and other necessary supplies. Last night, we announced that there were 31 confirmed and presumed positive cases of COVID-19 in 12 counties throughout our state. Today, it is with great sadness that we have to report the state's first patient death from COVID-19. The individual, a 67-year-old male, was hospitalized at Wellstar Kennestone since testing positive for COVID-19 on March the 7th. In addition to being infected with coronavirus, this individual had an underlying medical condition. Marty, the girls, and I are continuing to be in prayer for this individual and his or her loved one during this incredibly difficult time. I know that the medical professionals on site did everything that they could, and I greatly appreciate their efforts. Our hearts go out to his loved ones, friends, and the community. And we also continue to pray for the safety of the healthcare providers across the state who are working hard on patient care. Out of the new confirmed cases, one individual is a resident of Lee County and is hospitalized. The source of the infection is unknown. One individual is a resident of Cobb County and is hospitalized. The individual has a history of travel outside the United States. One individual is from Floyd County and is also hospitalized. The source of the infection is unknown. And 3 of the newly confirmed cases of COVID-19 are residents of Bartow County. 2 of those individuals are hospitalized and the sources of infection are unknown at this time. Based on our initial investigation, it seems that these cases may have had a connection to a local church in the Bartow County area. The 3rd individual is not hospitalized, and while the source of the infection is unknown, this individual does share a connection with the individual from Floyd County that has been mentioned previously. The Georgia Department of Public Health is also awaiting confirmatory testing from the Centers for Disease Control and Prevention on 3 new presumed positive cases of COVID-19. 2 individuals are from DeKalb County, both are hospitalized, and the source of their infection is unknown. There is no connection between these 2 cases. The other 2 presumed positive cases involve a resident of Lowndes County, and that individual is hospitalized. The source of the infection is unknown. As the number of cases continue to grow, we continue to closely communicate with our K-12 and higher education communities to ensure timely decision-making for families as well as the stakeholders involved. The Georgia Department of Education, University System of Georgia, Technical College System, and local school leaders have been invaluable partners to determine the best measures to protect students, teachers, and administrators. For local school systems, we've already seen limited closures in specific areas to deal with the recent cases of coronavirus. We know that school closures have a major impact on our Georgia families. Given the rise of the coronavirus cases, along with the push for more school closures, I'm going to issue a call to action for community leaders, educational leaders, and child care providers across our state. If you feel that it is prudent, you should consider closing daycares, schools, or school districts as early as tomorrow through the next 2 weeks. In addition, county and local governments should consider what closures might be appropriate that do not affect essential services. I want to emphasize that this is not a mandate. At this point, we believe that local decision-making is the right course of action and that you have the flexibility. Regardless of whether you stay open or decide to close, we will support that decision. At this time, I'm not shutting down state government or the Georgia State Capitol. However, I am immediately suspending non-essential travel and implementing telework policies for most state employees because it's simply the right thing to do. This arrangement will prevent substantial disruption of services to our constituents, but also help mitigate risk. We will be sending out guidance to all agency leaders shortly after this press conference to ensure that they have the right plans in place for implementation. Also, we'll issue directives to the Departments of Behavioral Health and Developmental Disabilities, Corrections, Juvenile Justice, and Veteran Services regarding visitation. Until April 10th, 2020, department facilities will completely suspend visitation except for next of kin and end-of-life situations. This decision, as you can imagine, was not made lightly, but we must do what we need to do to keep our people safe. These populations are in close contact, some with underlying health conditions that if exposed to coronavirus could result in a serious medical problem or cause widespread infection. Yesterday, as you know, I sent a letter to Speaker David Ralston and Lieutenant Governor Jeff Duncan, who are standing with me today, to request $100 million in the revenue shortfall reserves to address the spread of COVID-19, ensuring that Georgia has the resources at hand to enable us to quickly and thoroughly prevent the spread of the virus within our borders, which is critical to keeping our citizens safe, maintaining our health network, and mitigating negative economic impact. I cannot tell you how much I appreciate their solid support and leadership on this issue. With their help, we will have more tools available to address our health needs in the weeks ahead. Given the quick rise of cases across our state, it is necessary to expand the task force reach and build working committees for detailed briefings and analysis. Today, I'm announcing the creation of several new working committees to make sure that we're covering all of our bases for coronavirus here in our state. First, I'm creating the Emergency Preparedness Committee, which will be chaired by General John King, our state's insurance commissioner, with the mission of analyzing the availability of necessary supplies and evaluating all logistical needs that we may have. Their job is to continue thinking ahead, as we have all been doing for the last several weeks, but also laying the groundwork for supply chain needs and demand for critical services, including things that may not be on our radar at this moment. I also will be creating the Economic Impact Committee. It will be chaired by our state economist, Jeff Dorfman, to work with academia, business leaders, and lawmakers on determining both the short and long-term impacts of this virus on economic and financial sectors. I've asked Lieutenant Governor Duncan and Speaker Ralston or their designees to serve on this committee with us. I'm also creating a primary care physicians committee to be chaired by Dr. Ben Watson. To make the best decisions for our health network and to have an open, consistent line of communication, we need to hear from and coordinate with medical experts who are familiar with providing frontline medical care. As you all know, Representative Watson or Dr. Watson is a veteran in this field, and his committee's work will be critical in the days and weeks ahead. We will also be asking other lawmakers who are physicians to serve on this important committee. Lastly, I'm creating a committee to advocate for an especially vulnerable part of our state's population, our homeless community. The Committee for the Homeless and Displaced will be chaired by Atlanta Mayor Keisha Lance Bottoms, who certainly understands the importance of this fight and knows what we need to do to ensure adequate shelter, resources, and care for these Georgians. In the days ahead, we will announce the full committee member list, and I'm looking forward to working with them as we continue to address this health challenge that our state and our families are facing. Before I turn it over to my counterparts, I'd like to leave everyone with a few important points. To address real-world problems like we're facing today, I will be addressing some real-world examples. There are numerous constituents who have raised concern with the state's decision to utilize Hard Labor Creek State Park for the isolation of specific patients fighting infection. Let me be clear. These are non-critical, stabilized patients who do not have a viable alternative for shelter. I will give you an example. Imagine a family with an infant and one parent who is sick with COVID-19. The parent who is sick cannot go home because it risks infecting the infant's only other caregiver. Neither of those scenarios is acceptable. We will continue to use Hard Labor Creek State Park because, quite honestly, some people have no other choice. If your doctor or medical provider has recommended isolation or quarantine, it is critical for you to follow that advice to prevent the spread of this virus, even though you may not be experiencing symptoms. If you ignore this medical advice, you are literally endangering lives in our state. It is simply not worth it. Please, I beg you to please do as we are asking you to do. I want to thank President Trump and Vice President Pence for their leadership on fighting this across our country. They have empowered state and local leaders to take necessary action to keep our families safe, and they've been incredibly accessible as they continue to offer their assistance, but also heed our advice. I also want to thank everyone who's standing here with me today. I know these individuals have been putting in some very long hours and operating with very little sleep, but you would never know it. I'm grateful to this team. I want to thank everyone who's watching or listening and who may be sick with COVID-19 and have them realize that we are dealing with your fellow Georgians in this crisis. We must continue, as we are here today, to be united. They need our support, and we will continue to stay in this fight together. With that, I'm going to turn it over to Dr. Toomey, and she'll give you a quick update. Dr. Toomey.
Good afternoon, and thank you so much, Governor, for your leadership and forward thinking at this time of public health crisis. I wanted to say, first of all, that since we have seen an emergence of pockets of local transmission in Georgia, it's absolutely the right decision the governor made for us to be moving forward aggressively with a change in our message that to ensure that particularly those most at risk, those most vulnerable, can be protected. And that is, once again, those older individuals, and older means 60 and over, so that includes many of us in the room, as well as those with chronic health conditions, diabetes, hypertension, kidney disease. immunocompromised individuals, including those on medication, for example, for rheumatoid arthritis, that may make you immunocompromised. And please don't go out if you are ill. I mean, what we have seen cases where individuals known to be ill have gone out into the community and potentially exposed others. So once again, personal responsibility, but also protection of our families is critical at this time of this pandemic. I also wanted to just proactively answer some questions that we are getting, many questions in Georgia Public Health about a number of things. People are asking, what is the capacity now for testing? Our capacity is changed even since I last talked with you. We are going to have 2 additional pieces of equipment to do this testing by Monday. Additional staff are being trained to increase our testing capacity. We currently can do about 50 tests a day. We hope by as early as next week, at the end of next week, we will be able to do up to 100 tests a day. We got additional shipments of materials from the Centers for Disease Control and Prevention to allow us to do this testing. And so we have enough for about 500 patients right now, and will continue to request this from CDC. We could not do our job without CDC's help and support. And so I just want to again thank them for the support they've given us and all the other states. It's been a hard challenge for them, and we are lucky to be co-located in this state with such a tremendously supportive partner. We've had many questions from physicians. How can we get our patients tested? And one of the things that I've always emphasized is make sure that individuals who want to be tested don't just go to an emergency room, don't just go to a physician's office, because we don't want anyone with coronavirus or influenza or measles to expose those individuals in the waiting area. Call ahead, make sure that these tests can be done. But CDC is doing everything they can to ensure that we have expanded opportunities for testing. They've actually made the guidelines for the PPE, for the protective equipment for providers taking these tests to be a lot easier. You don't need the special N95 masks to wear a surgical mask, and less protective equipment is required. So this means most doctors' offices can take these tests, which will be as simple to do as taking a flu test or a viral panel. And then these can be sent to LabCorp, which is now functioning, and we're getting many test results from LabCorp tests, which are coming directly to us as well as to the provider, and then our public health laboratory. We please ask providers who are listening, call ahead, 1-800-PUB-HEALTH, PUBHLTH, which is our emergency contact line, to alert us that these tests are coming in, that we can be on the lookout for them and facilitate, particularly if they're high-risk individuals. I know you have a lot of questions about symptoms. What are the signs of having COVID-19? Perhaps no one has done more to help us in this area is Tom Hanks yesterday, when he tweeted about his COVID-19 infection with his wife, and that their symptoms seemed like a common cold. They had malaise, fatigue, they maybe had a runny nose and a cough. These are the same signs you have when you have the flu. These are the same signs you have when you have other viral infections. So it's difficult, particularly for those 80% of cases that are very mild, to distinguish between this and other viral infections. So it's so important to ensure that you, if you have a suspicion, particularly if you've been in contact with someone with COVID-19 or have traveled, that you let the provider know ahead of time and go through those steps to ensure the safety of the other patients and the provider's ability to help you. We also know that 20% of patients have more severe disease, and 5% very severe disease requiring hospitalization or assisted breathing. And so for those 20% of patients with more severe disease, we again recognize that those with chronic health conditions, those older individuals, are more at risk for developing those complications. So that's one reason why our guidelines coming out today and will be emphasized and emphasized and emphasized in our communities to ensure everybody gets that message and helps protect their family members and themselves. I'll be available later for questions, but I wanted to proactively address many of the questions we've been getting today at work. Thank you.
Okay, now we'll hear from Atlanta Mayor Keisha Lance Bottoms. Mayor.
Thank you, Governor. I want to publicly thank the Governor and the leadership of the state for the support that we have received as the capital city of Georgia. The Governor has been in constant contact with me personally, and our teams have been in contact with each other. We could not have a more valuable and supportive partner in this effort. On a local level, we have taken actions that we feel address the needs of our respective communities. Specifically on yesterday, I signed an executive order halting the turning off of water to any of our customers, in large part because a lot of this has to do with washing our hands and the ability to access running water. We are also encouraging our employees who are feeling very anxious about what's happening to take leave if they deem it necessary for their physical and emotional well-being. On tomorrow, the city of Atlanta will test its teleworking policy, and we will then make the decision next week accordingly. I just want to address one rumor that was falsely reported in the media that we had an employee who tested positive. That is inaccurate. But we will continue to monitor our employees. Lastly, we will continue to work with our partners, including our partners at the school system, to make a determination if students are sent home for the next few weeks, how we can work together to make sure that food is delivered to families accordingly. And I'll just lastly leave you with some age-old advice that my grandmother used to give to me. You don't worry until you have to. The reality is that the vast majority of us have not been infected with this virus. But the best counter to what we are facing is preparation. As a city, we are following our business continuity plans. We encourage all of our local partners to do the same, including making evaluations on whether or not residents should be evicted during this time, whether or not electricity and gas services should be disconnected during this time. We ask that we remain the state and city that we are, and that is a place that combines commerce with compassion. Please continue to keep in mind the hospitality industry that is impacted, and to the extent that we are still frequenting businesses, perhaps tip just a bit more, because many of our communities will be hurting, and we will continue to work with the governor and the state as well as our federal partners to determine how we can financially stand in the gap. Thank you.
Thank you, Mayor. General King.
Good afternoon. Thank you, Governor. For those who might not know me, my name is John King. I'm the Insurance and Safety Fire Commissioner. I will be using my experience, obviously, as a senior military officer and a first responder to work with members of the Preparedness Task Force and provide private sector to accelerate the creation of long-term plans and to make sure every Georgian is prepared and ready. This task force will work diligently to coordinate with local, state, and federal agencies to provide the most up-to-date information to all Georgians and to provide practical options for our governor and his team. We will continue to work with the governor's goals in making sure this process is open and transparent. Thank you.
All right, folks, we're gonna take a few questions like we've done in the past. If you raise your hand, I'll try to make it around. We'll try to answer as many as we can. Richard, you wanna start us off?
Governor, a lot of people are watching right now. We heard the a lot of people are at grocery stores right now, cleaning out the shelves. What would you say directly to these people about how to proceed in the coming days? Don't panic.
Yeah, I think, one reason we're doing this, showing that we have a united front, is to keep everybody calm under just, the most unusual of circumstances that we're seeing, really a historic event, I think, in our state and our country, but as the mayor just said, we have been doing preparedness, we're gonna continue to prepare, and we're gonna continue to be truthful, with our citizens. I think for people that are in the grocery store right now, you know, I don't think you need to buy every loaf of bread on the shelf, you know, save one for your neighbor. It is not our intention to shut down commerce. I think that's what General King's subcommittee is gonna be working on, is the logistics, working with the private sector, so we continue to keep the supply chains open. We know that we've gotta have critical services open. We know that we've got to have the ability to get fuel, to be able to get healthcare products. You know, I heard a couple of days ago that the port traffic seems to be ramping up. I think a lot of that potentially is medical supplies that are coming into our port. Well, I can assure you, we're gonna get those supplies moved. So we are not, you know, cutting the head of the snake off, if you will. We are just continuing to be transparent. We've got, you know, some issues, especially in the metro area, with this virus and the number of positives that we're getting ramping up. That is gonna affect our communities. We've heard the angst from our partners at the local school district level. We wanna free them up to make best decisions based on what's happening in their community. That is obviously a lot different in, you know, Macon, Georgia, or Dublin, Georgia, than it is in Atlanta and Cobb and Gwinnett, where you've had cases confirmed. So we're gonna continue to be prepared, and we're gonna continue to get information out, but there's no need for people to panic. We're gonna continue to keep you updated, and most Georgians, their risk, as long as they're heeding the advice of the public health officials, continues to remain low. But we're also not gonna sugarcoat the issue that, you know, there was a religious, you know, a church that several members have been infected, and that is certainly a concern. So we're gonna be truthful with people, and we think the Georgians will heed our advice and best know how to deal with those situations if we do that.
Greg?
Yeah, Governor, some have accused the government of sending mixed messages. There's some events that are closed, there's some, like in Capitol, that's open, some schools shut down, some haven't. There still isn't a state of emergency. How do you respond to the criticism that you haven't done enough to send everyone one message?
Well, I would disagree with that. I think we've been very clear and transparent about what our message is. We're not to the point where we're, you know, mandating every single public school or asking, you know, our higher education institutions to close. We've heard those concerns from the local level. We are freeing them up, if you will, for them to make those decisions. If we get to a point where we feel that escalates and the public health officials are telling me that, then we'll react. I would tell Jordans out there, I'm not unilaterally making these decisions. You know, I'm conferring with the experts, Dr. Toomey and many, many others. Just like today on the task force, one of our subcommittees came out of a suggestion that we had from a task force member. So you have a lot of experts and a lot of people that are really smart working on this issue, and we're gonna continue to follow the facts and the science, in our decision-making process.
Angelique?
Governor, there are several parents who have students in our public institutions who are very concerned that after spring break this week, it's going to be business as usual back to class, and that we are exposing those students to the virus. What do you say to those parents?
We have been hearing that from the local systems, which is exactly why I've sent the direction today. They are freed up as of this afternoon. If they'd like to cancel, we will support them and do that. If they're in communities where they're, you know, continue to have low risk and they do not want to do that, then we'll support that decision. But school systems, higher education institutions, the technical college systems, they have all been freed up to take action as they deem fit, and I'm sure that you'll see many of them doing that.
Sam?
Governor Kemp, you mentioned that there are still some parts of the state that are deemed low risk, but we're only able to test 50 samples a day. Public health officials including Dr. Toomey, have said, as we test, we're going to find more cases. Do we have accurate testing capacity now to know the full scope of this problem in Georgia?
Well, I would let Dr. Toomey speak to testing and the public health part of that, because that is in her lane, if you will. I can just tell you, we're following the data and the science that we have. Dr. Toomey?
No, initially, the public health lab was the only game in town. And we will be free probably by Monday to call cases, not have to get CDC confirmation. But there are now commercial laboratories that are working in our state, including LabCorp, and I suspect others will come in, because there is a market for COVID-19 coronavirus testing. And I also believe that there will be hospitals who choose to do testing as well. And so we are just seeing the beginning of what will be a process of expanded testing. And you're absolutely correct. As we test, the more we test, the more we'll understand where the virus is. And our current statistics look a little skewed, and that's because we're testing the highest risk patients, usually hospitalized, usually those with chronic health conditions. And for that reason, our statistics are not individuals who are at low risk. And I think as we do more testing, we'll get a better picture of the statewide spread of the epidemic.
And Dr. Toomey, countries that have really made an impact on this, China, South Korea, have rolled out large-scale testing.
Italy,
Drive-through
yeah.
booths, is that something that you would expect home for?
Absolutely. We are actually working right now to identify testing sites that are not associated with hospitals or health departments, that will be staffed and will be open, and that providers can, around the state, send individuals to be tested. I think it's going to be difficult to not be tested without some sort of referral from a physician or other healthcare provider. Our goal is to have those set up statewide, not just in metro area, and some of those will be set up as early as Monday.
Rule.
For the governor, the speaker, and lieutenant governor, what is the plan for the rest of the general assembly?
Maybe let's all speak to that.
I think we have a short answer. The Lieutenant Governor and I will be announcing a plan to our respective chambers probably in another hour or so with some detailed information.
Adjournment versus
Speaking,
Speaker Wilson, is adjournment versus suspension an option? Can you give us a little more?
we will address that
Andy?
to our members first.
Governor, how do you, you requested the 100 million, how do you feel like that's gonna break down? How will that be spent?
Well, I don't think we have an answer for that. When I talked to the speaker and the lieutenant governor, we just talked about having availability there when we need it, just for safe assurance, to give us resources to work with. We have, money flowing down, I believe, as early as today or first of the week from the federal government. The vice president, I did not get to speak with him earlier. I know someone on our staff did, to give him an update on where we are and talk about some other things. But I know they're looking at other measures and they're already taken. So I don't know that we want to try to get into explaining the funding on this right now, because we're going to have a lot of resources available. I know that they're working on tweaking some of the healthcare formulas to be able to help our hospitals. What the specifics are on that, when we get that, we will let you know, but I know that they are diligently working on that, and I believe I can speak for the speaker and the lieutenant governor. We have great appreciation for that.
Joe?
Governor, I know your office put out a letter yesterday on getting the most up-to-date numbers from your office and from DPH. Those numbers have since disappeared from DPH's website. We've heard from viewers in the Floyd County area where they had cases announced by a hospital on Monday and Tuesday. It took 24 to 48 hours for those numbers to come up on the state's numbers. Do you have any reaction to people who don't have full faith in the state's numbers? When you have Florida, for example, they're constantly updating the number of tests is pending, negative results. They're giving age, sex, city, and travel history of patients. Any reaction to that?
I would just let Dr. Toomey speak to that. I know that from my staff's perspective, we've been putting those out on Twitter. We've moved from press releases to social media announcements, when we're still updating everything the traditional ways, but just to get the information out as fast as we can. But perhaps Dr. Toomey will speak to that.
Very quickly, this is a late breaking news, that we have worked on the development of an online tool that will, as we enter cases in, it will update both the numbers and a map, so you can see the actual epidemiology, the picture of where the virus is. And that website, which will be linked to our public health website, will be up in the next day or two. And so whether it's the general public or you as the news media can have access to these numbers, not in real time, but will be updated probably every day at midnight, so it will be the most up to date. And even the things like LabCorp data will also feed into it, so we will have the best information we have available, both from providers as well as the public health laboratory.
And real quickly, with two possible cases coming from the same Bartow County church, has that full congregation been notified? Can you disclose which church that is so the public is aware?
Our epidemiologists are working in that community to ensure that everyone who is at risk has been notified and taking appropriate precautions, including confinement in their homes and monitoring for the risk period.
Arch?
Governor Kemp, several sporting events have already been canceled. We're expecting thousands of visitors to Augusta for the Masters. Should they cancel that given what's happening with all around the country?
Well, I would just tell people, we've been in constant communication with all of the individuals tied to the sporting events here in Georgia. We continue to do so. Dr. Toomey, I know, has been in conversations with them, giving her opinion on where we are. They're obviously working with their own teams in that regards. Quite honestly, those events that have been closing have been done very rapidly. And I think, as far as what's going on in Augusta, I know that they're on top of it, and I'm sure they'll have more to say at a later time, but I don't have any sort of pending announcement on that. So I would just tell the individuals that are looking to come to Georgia to stay tuned for what they're hearing from Augusta National.
And real quickly, the economic impacts of some of these, the Final Four, all of these that are not canceling events in Georgia.
Well, sure, the economic impact is gonna be substantial, not only for our state, but for our country. These are unprecedented times that we're in, right now, but that's exactly why we put this, subcommittee, the task force together to deal with the economic impact of this, so we can be monitoring that daily, working with the speaker and the lieutenant governor and the members of the General Assembly to prepare for that from a budgeting perspective. But I'll also tell you that these two gentlemen and myself, we will be prepared to act. So when this curve heads down and it starts to end, we will be ready to put Georgians back to work and bring our economy roaring back like it was just a few days ago.
And folks, multiple outlets and multiple people here, so I'm trying to give each outlet at least one